It's the Daily Dose from Countable, what your government's doing and what you can do about it. I'm Andrea Seabrook. Should doctors at the VA be allowed to tell veterans that they could benefit from using medical marijuana? That's a big question people are talking about today on Countable. A bill in Congress is called the Veterans Medical Marijuana Safe Harbor Act. It was introduced by two Democrats, Bill Nelson of Florida and Tim Kaine of Virginia. They propose that doctors at the U.S. Department of Veterans Affairs should be able to, quote, discuss and potentially recommend medical marijuana to veterans in states that have established medical marijuana programs. Your voice on this one matters, and here's why. There is an inherent problem in American society today with pot, with weed, marijuana, whatever you want to call it. More than half of the states, and I mean well more than half of them, have legalized marijuana in some form. That's 33 states, and it's more if you consider territories and the District of Columbia. At the same time, the national government, the feds in Washington, D.C., still classify marijuana as illegal. In fact, super duper illegal. The DEA, the Drug Enforcement Administration, considers marijuana to be like heroin, a Schedule I drug with a, quote, high potential for abuse. And here's a really weird thing. Marijuana's classification on the federal level includes this definition. It has, quote, no currently accepted medical use. And how strange is that? That a drug that fully 33 states have legal medical programs for, to the federal government has, quote, no currently accepted medical use. The truth is, here's what's going on. We all live in two places at once. Sounds weird, but it's true. Under U.S. law, we all live in two places. We live in a state where we're required to follow its norms and laws, and we live in the United States with its own set of federal norms and laws that we are required to follow. The thing is here that the laws at the state and federal level are not often so diametrically opposed. It's kind of fascinating. So what that means for a doctor working at the VA is that he or she is required to operate on a federal level. Even if they wanted to, they cannot tell a veteran they're treating that, hey, marijuana could help you with PTSD, with pain, with any number of ailments. And that is even if that veteran lives in a state where medical marijuana is an option. The VA doctor telling that patient it's an option risks their job and their medical license just by saying so. And so, the bill before Congress and on Countable right now is the Veterans Medical Marijuana Safe Harbor Act. It would, quote, ensure that doctors who work for the Department of Veterans Affairs can discuss and potentially recommend medical marijuana to their patients in accordance with state law. It is an attempt to square federal law with state law. What's your take? If this issue is important to you, you've got to tell your representatives. Check out the actual proposal and tell your government what to do. Both are just a couple clicks away on Countable. It's citizen tech putting you in charge of your government. I'm Andrea Seabrook. Talk soon.